Hello and welcome to Early Childhood Education and Care in a Shifting Landscape, presented by Early Start at the University of Wollongong. My name is Leanne Gibbs. Tonight we come together as a community dedicated to the rights of children. We're gathering across many lands of the world, and Early Start would like to begin this event by acknowledging the traditional custodians of the land where we meet. We have special guests from 2 early childhood education centres to help us. The children of Kids Uni South here at the University of Wollongong and Dalaga Preschool in Kempsey, New South Wales share with us their acknowledgements.
At Kids Uni, we'd like to say thank you to the Dharawal people for letting us share their lands. We promise to look after the land and the animals and the people too. Here is Mother Earth. Here is Grandfather Mountain. Here are my friends. And here am I.
Here is the sky.
Here is the sky.
Here are my friends.
Here are my friends.
And here am I.
Here am I.
We thank the Dungari people.
Thank the Dungari people.
For the land in which we learn and play.
For the land in which we learn to play.
Hands up.
Hands up.
Hands down.
Hands down.
We're on Dungari ground.
Dungari ground.
We did all the grandfather, son, all right. Everyone hands in. Everyone come in. Everybody put your hands in. Are we going to have a good day? Yeah! 1, 2, 3. Yay!
How will our evening go? First of all, relax and get comfortable because you won't want to miss a moment. Our focus tonight is firmly on children. First, you will hear from our incredible international speakers. Then there is an opportunity to ask questions. Please use the chat box for questions and comments. We'll be sure to share as many of your questions as we can with our international and local experts in a panel following the presentations. Our local experts are Cathrine Neilsen-Hewett and Tony Okely, whose expertise in the field of early childhood is world-renowned. Cathrine and Tony will also introduce our speakers. And so, over to you, Cathrine.
Good evening, everyone. I'd like to extend a very warm welcome to everyone attending our UOW Early Start webinar. My name is Cathrine Neilsen-Hewett and I'm the Director of Pedagogical Leadership here at Early Start, and I'm also the Academic Director of our Early Years program here at the University of Wollongong. Now, I have the honour and pleasure of introducing our first presenter for this evening, Professor Jane Bertrand. Jane is the Program Director at the Margaret and Wallace McCain Family Foundation, which focuses on early childhood practices, policy and research in Canada. She's an adjunct professor at OISE, University of Toronto, and participates in their Flex Early Learning PhD program. In Australia, she is currently on the Research Advisory Committee for Our Place in Victoria and Good Start's Thought Leaders Advisory Group. Jane's contributions to the field of early childhood have been significant. She has been the research coordinator for the Early Years Study, which commenced back in 1999, Early Years Study 2, Early Years Study 3, and now the Early Years Study 4, which she'll be drawing on in her presentation this evening. She worked with the Ontario Early Learning Advisor to the Premier of Ontario that led the full day kindergarten for 4 and 5-year-olds. She was the chair of the Ontario's expert panel that produced the Provincial Early Learning Curriculum Framework. And in 2013, she received an honorary doctorate from the University of New Brunswick for her contributions to early childhood education in Canada. She's a member of the Directing Committee of the Centre for Excellence for Early Childhood Development and was a member of the Toronto First Duty Research Team. It is an absolute honour and pleasure to have Jane presenting at our first Early Start webinar, and I know we will all benefit greatly from her shared insights. Now tonight we have 2 presentations, and at the end of the 2 presentations we'll be conducting an open discussion with Jane and our other presenter, Tove Mogstad Slinde. And we would like to invite you all to contribute to this discussion and ask if you have any questions that arise during either of these presentations, that you enter these into the chat function in the webinar.
Hello, I am Jane Bertrand, and I'm delighted to be here this evening to take part in the webinar hosted by Early Start at University of Wollongong. The title of our webinar is Early Childhood Education and Care in a Shifting Landscape. And how shifting that landscape is as we are now into our 7th month of the pandemic, which is making our efforts around early childhood education more critical than ever. Tonight, this evening, in this presentation, I'm going to share with you an overview of a new report that we launched in February 2020, Early Years Study 4, Thriving Kids, Thriving Society. It is the 4th in a series of studies, all entitled Early Years Study. The first was in 1999, and it was led by Dr. Fraser Mustard and the Honorable Margaret Norrie McCain. Fraser took findings from that study and supported the growth of early childhood education and support to early child development across Canada. He spent much time in Australia. He was welcomed by the World Bank, by the Aga Khan Foundation, and he moved the markers on taking this important research and base of evidence forward. One of the key statements or the key themes coming out of Early Years Study 1 was this notion that early childhood was the first tier for early development, for human development. It was just as important as primary or elementary school, secondary school, or post-secondary. And that is the theme that carries forward into Early Years Study 4. Unfortunately, Fraser passed away, but Margaret McCain has continued this work and is brought forward on the 4th edition for you. And I'm going to give you a quick tour of some of the key messages that I believe resonate as much as ever, given it may matter a whole lot more given the context we were in the middle of the pandemic. There will be time for questions later on after the presentations. First of all, Early Years Study 4 really emphasizes that age 2 to 5 is a unique time for learning, different than the earlier first 1,000 days, which are critically important and set the foundation for everything that happens later and we carry forward into our adult life. But the second 1,000 days really lay the foundation for what I'll call human learning, or learning that is socially constructed, learning that we acquire from our culture, from our families, from the environments we are in. We learn language, to speak language and to listen and hear language from before birth, where you're starting to learn that. And we acquire, unless something is a major impediment, we acquire language from the world around us, from hearing it and incorporating it. Our brain is pre-wired to acquire that. Learning to read, however, is a socially acquired skill. We have constructed literacy and systems over time, and we pass them along from one generation to the next. It is this kind of learning that begins to really take off in that period of time, the age 2 to 5, when the mid part of the brain is wiring up with our prefrontal cortex at the front of the brain, which is a unique human feature. What is preschool learning in those critical years between 2 and 5? Well, in Early Years Study 4, we talk about it, we organize our thinking about preschool learning into 3 real buckets or 3 categories. One is language. We learn to start acquiring language earlier, but we really become much more skilled at understanding and expressing language between 2 and 5. We start to use language to talk about our intentions, about our observations, to explore our ideas. And while we may not learn to read yet, we are becoming aware of print systems and symbols that carry those language meanings forward. Our thinking skills expand rapidly as we're able to start planning and assessing ideas, where we're processing information, we're imagining what if. We're putting together abstract thoughts now that we can think about and carry forward. Well-being is the third bucket, and it refers to social, emotional learning and also to physical well-being. It is about the relationships we form with others, with our friends and our family. It's about how to start to understand what we can do to have healthy bodies and what a healthy body feels like. And we start to understand our emotions and what they mean and start to be able to express them. Preschool learning, thinking, language, and well-being are not discretely separated from each other. They're very much intertwined and interconnected and form the basis for much of the learning that goes forward. Early childhood education is grounded in the idea of children's play. We think about it as play with purpose. Early childhood education is for children the 21st spaces and places to get together with friends. Very important to young children. Playing with other children is what matters most when we do research and talk with children and interview them in early childhood education settings. We can think about play, different types of play that take place in early childhood education, different types of strategies that we use to support play. There is no one best way to play or to promote children's play. We're best when we have a suite of strategies and provide different opportunities that go from play that is child-directed, sometimes called free play. As educators and teachers, we have responsibility to set up the environment and to pay close attention to what children do when they're directing their own play. We can think about a number of different ways in which educators can guide children's play, but still respect children's centrality. And inquiry play is where children ask questions and explore ideas, and we can support them in moving that forward. We can offer resources, sometimes ask questions, provide provocations to nudge them along, but we're following the children's lead. In collaborative play, we co-design play opportunities with children. We may join in their play and add some ideas and questions and skills into that play. When we talk about playful learning, as educators and teachers, we may take more of a role in setting up specific experiences that allow children to meet specific learning objectives. We're still respecting, though, the children's lead, and we're paying attention to what matters to them and where their learning is at and what they're eager to learn more about. And finally, we can talk about educator-directed play, where educators and teachers set up prescribed learning activities with specific goals in mind, perhaps to promote specific learning skills involved in early literacy or numeracy or social emotional learning. A very simple example of that is Simon Says, where we ask children to copy what we're doing if we say Simon Says. All these play episodes, all of these types of play are valuable for children and help them acquire the skills for learning and for learning further as they go forward. Early childhood education is very much a step up for all. All children, all families, all communities thrive when early childhood education is available, accessible, and of high quality. There are benefits for everyone. Inequality is problematic. And now with COVID-19 amplifying inequalities, it becomes even more important that we pay attention and try to reduce inequalities. Inequality hits the young hard, In our Canada, about 1 in 5 children are living in poverty. Inequality discriminates and is greater for children living in racialized families who are racialized and in low-income families. It discriminates more heavily, and we need to think about how we can close those gaps and reduce inequities. Inequality is sexist and hits women harder. We're seeing that with COVID as women's return to a workplace, at least here in Canada, is lagging behind men's return. And inequality exists everywhere. Even if we're making progress in various areas and trying to close the gap, it still exists and we still need to pay attention to it. The threat of the world we're living in now with the pandemic, which threatens to expand the equity gaps, it matters even more that we pay attention to this. Early childhood education can make a big difference and close the gaps. For example, we know that early childhood education addresses a number of special education needs and reduces gaps, inequity gaps. Some of the most common reasons for special education needs when children enter into formal schooling are literacy and numeracy lags, language delays, behavioral problems, and low socioeconomic status groups are overrepresented in special education needs. We also know the benefits, the significant benefits of early childhood education in enhancing literacy and numeracy skills, in enhancing language skills, bringing on stronger self-regulation and reducing behavioral problems. We also know that early childhood education benefits vulnerable children the most, benefits low-income children the most. So with that, early childhood education, it's not a magic bullet that's going to make everything okay, but it can go a fair distance in reducing the gaps and reducing inequities before children begin formal schooling. So what does that mean for ECE and public policy? We know that public policies matter for families. They matter a lot. In particular, parents benefit from parental leave and benefits that provides them a guarantee of time off after the birth of their child and some income support to make that possible. And when I say parents, I mean the birthing parent and another parent if another parent is involved in the baby's life. Child tax benefits that help redistribute income and raise low-income families who may be low-income, low-wage earners or may not be in the workforce. Child tax benefits go a distance in reducing the socioeconomic inequities. And finally, public funding for early childhood education is critical if we want to really meet the needs of families through our public education, through our public policies. And the results can be seen in years, not decades. It doesn't take 40 years to see a difference. A few years can change things around in reducing inequities and improving children's outcomes. So, how do we rethink early childhood education? How can we rethink how we're providing it? First of all, we need to do away with the dichotomy of care and education. Good education cares, and good care educates children. So the idea of having child care arrangements that are separate from early learning opportunities doesn't make a lot of sense. It's not good public policy, and it certainly isn't going to get us the same benefits for children than when we recognize these two things are combined and we need to set up our systems and policies accordingly. We can call early childhood education many things: nursery schools, preschool, pre-kindergarten, full-day kindergarten, primary, pre-primary, And they differ from jurisdiction to jurisdiction, what we call it. But regardless, early learning and care combined together can make a difference. And there are some components to the policies we can pay attention to. First of all, in Canada, we are finding many benefits in linking early learning opportunities to our public education platform. This may be a more unique opportunity in Canada, where 95% of the population send their kids to public education. So it's a pretty universal platform, and one that many of our provinces and territories are building down to accommodate younger children before they enter what we call grade 1 when they're 6 years old. And so that is one thing. That is a platform that is by and large respected. It's non-stigmatizing. It's in every neighborhood. And it's one opportunity to start to think about how to expand early learning and care opportunities. We also need to think about childcare costs. We need to reduce those for working families. It simply is not possible for families to, out of their own pocket, out of their own income, to pay the full cost for quality early childhood education, particularly full-time programs. So we need to think about what is manageable, what is doable for families to pay, and how can we accommodate that and reduce it. What is the demand for childcare? What we find in Canada is that when it is offered to everybody, when the cost is affordable or there is no charge, the take-up is high. We have public education systems offering full-day programs for 4-year-olds, and the uptake is 95, 96, 97% of all children. Where we see less demand is when we don't have subsidizations and we're not able to bring down the cost of programs, and therefore only those that can really afford it or those that are really low income and can get full subsidization. Even then, our programs tend to be full with long waiting lists. We have not met the demand. We need to think about the benefits of quality care going forward, and those benefits very much rely on having quality early learning experiences for children, to paying attention to what their needs are and how best to support their learning. And that brings us squarely to the final point I want to make about the kinds of ways we need to rethink early childhood education. We have in our country, and I believe in many in Australia and in other countries, are facing a serious, significant early childhood workforce challenge. It is hard to attract and retain qualified early childhood educators and early childhood teachers. We do find that when the work environment supports professional practice, supports professional compensation, and is providing a publicly managed infrastructure to support early childhood education, it is quite possible to attract and retain qualified educators and early childhood teachers. They are able to earn a living and project a career. It is when we don't provide those kinds of well-supported work environments with decent compensation and benefits that we struggle. In order to meet the early childhood workforce challenge and to bring quality in and to meet the demand, we need to build those costs into the childcare overall costs, and we need to ensure that there's public funding large enough to accommodate that so that parents can afford the level they're asked to contribute, but it doesn't negate having a decent compensated workforce. So what is the next step? How do we move forward from what many people call a patchwork of programs, many delivered through the market place without a lot of public management? How do we move forward to something that's more cohesive and meets those policy requirements that I just talked about. What is our next step? In Canada, we know we can do better. We know that we can do better in meeting the needs. And the guiding principles that we put forward in early years study 4 are, 1, entitlement. We need to see early childhood education as an entitlement for all children for at least 20 hours a week. And also entitlement that provides options for an extended day if parents are in the workforce and need that additional coverage. Second of all, we need universal provision. We need to make it available for all children and not target it to vulnerable children. Vulnerable children may benefit the most in what they acquire from quality early childhood settings, but they are best served when they are in a universal mix of kids. Think about it. If children are having and struggling with language delays, are they going to do better in a group of children who all have language delays? Or are they going to excel more and acquire vocabulary and language more if they're in a mixed group of kids, some of whom have fairly advanced language skills? Universal provision is important. It also destigmatizes participation in early childhood education. Thirdly, we need a public infrastructure to support early childhood education programs, either through existing public platforms, such as in Canada, our public education system, or in some cases through municipalities, or through public management of other types of programs, of nonprofit and commercial programs, but strong public management that requires the kinds of work environment and compensation that mandate that a professional early childhood workforce needs. Professional infrastructure that ensures parent fees don't go beyond an unaffordable level. A public infrastructure that embeds ongoing learning for educators and for early childhood teachers. A public infrastructure that provides solid quality pedagogical leadership. Our fourth principle is we absolutely must have adequate public funding that allows us to have the quality necessary without making it restrictive to the majority of parents and what they can afford to pay. We may still need some parent fees. It may need to be guided on more of a sliding scale, but it cannot be the levels that are now asked of families in my country, Canada, and I know in Australia has been a problem, some progress being made towards that. We need adequate public funding so that it is available and affordable to all families, making universal provision possible. Finally, I would like to point out and recommend the need to monitor the impact of public policies going forward. We have a Made in Canada tool for that, the Early Childhood Education Report, that has established benchmarks of quality in 5 categories: governance, funding, access, the learning environment, and accountability. It is based on the public policy work by the Organization for Economic and Cooperative Development, by the Early Childhood Care and Early Childhood Education and Care Network, and the research that's been ongoing within that group. But we've customized it to Canada's context, to how things work in Canada. We've also made it not totally aspirational, but doable, where at least one jurisdiction was meeting each of the benchmarks that we have identified. A tool such as this in Australia would have different benchmarks, but the concept could be the same, in which you identify where you want to go, where you want the states to go in their leadership, in their role with providing early childhood care and education. It has been very helpful in tracking the impact of public policies. The fourth report, it comes out every 3 years, the fourth report, Early Childhood Education 2020, will be out shortly in early 2021, and will give us some indication of the impact of some of the federal government's public policies that have been were put in place since the last report was out in 2017. Our final section in early childhood education, our final section in early years 4 is becoming a capable child. It was prepared by our dear friend and colleague, Dr. Angela James. Angela is a Manitoba Métis woman, and Métis is a unique group of Indigenous people in Canada who share a culture and history. Angela was from the Métis Nation in Manitoba and moved to Northwest Territory, where she joined, through marriage, Chipewyan Dene family. She has a rich career in working in the Northwest Territory government. She oversaw the early childhood education and school framework, the early child development and education framework for the Northwest Territories, and she is currently the Director of Indigenous Language and Education Secretariat. So Angela crosswalks and bridges early childhood education in schools, and she also is a valuable bridge in bringing her doctoral research in understanding Indigenous ways of knowing young children into Western world. And we value her very much and what she's been able to contribute to our understanding as we work together. Angela shows us examples, multiple examples of Indigenous teachings that point to a child as a capable person, which reinforces many Western perspectives that are informing our work in early childhood education. It is a most valuable section, and Margaret McCain very much appreciated Angela joining her and making this significant contribution to our early years study 4. I close with the few resources. Early years study 4 is online. All of the references for all of the slides and studies I've talked about are documented in the early years study 4 on the website, and you can download the full report. They're all noted. I also recommend you have a listen to early years study podcast. It includes 8 episodes. One is an overview, and each of the others are interviews with contributors, and most with also Margaret McCain, for each of the sections, each of the chapters in early years study 4. And the link to that is available there. And finally, I suggest you have a look at the website for that early childhood education report that tracks and monitors how we're doing in bringing forward new early childhood policy in Canada. Thank you. Stop there, and I look forward to discussion and questions.
Hi, my name is Tony Okely, and I'm the Director of Research here at Early Start. Tove Mogstad Slinde is a Senior Advisor in the Norwegian Ministry of Education and Research. Prior to this, she spent 6 years as Chair of the Network on Early Childhood Education and Care in the OECD. In the Ministry of Education and Research, Tove has worked extensively on policy development topics related to quality in early childhood education and care. Since she entered the sector in 1987, she has advised on the governance and implementation of policies at a global, national, regional, and local level. In this presentation, Tove will explore how the COVID-19 pandemic has had a global impact on the early childhood education and care sector. She'll discuss issues surrounding funding, access, and engagement, and will outline what is needed to ensure the future success of the early childhood education and care sector. We welcome you, Tove, and look forward with excitement to what you have to share with us in your presentation. Thank you.
Snow is like rain, only slower and colder. If you hold still and let it fall on your nose, it tickles. I lost a tooth once. We were sledging and then we crashed. But it was okay, because the tooth was loose anyhow. How can you crash really hard into something really soft? The small children sleep outside even when it's cold. They don't mind because they have really warm sleeping bags. I'm always warm, even if it's cold, because I play so much.
So first of all, I would like to say thank you to the organizers of this Early Start webinar series to invite me to share the Norwegian experiences and approaches to ECC policies and practices during this COVID-19 crisis. I would so much more have liked to have been with you in Wollongong at this time, meeting you face to face and having the discussions and exchanges that I know for sure will help us deal with the situation and learn from each other. But this platform will have to do. Hopefully it will still work in this way, that it will help us by sharing experiences and having discussions on the topic. So I will start now and share my presentation. So, being a government official working at the Ministry of Education and Research, my input will be about government policies and responses in this situation. So this is what I propose to do. I will present you with the Norwegian experiences and approaches and start by setting the scene, so that you will understand the context of our measures. I will move on to the close down, the decisions, consequences and discussions, the issues of funding and collaboration. And I would also like to raise the topic of child perspectives. Then moving on to the opening up of our institutions again, the guidelines that were developed, the organizations and practices, and also the issues of participation. And then finally, the last part will be about the continuance, the situation we are in just now with our traffic light model and the policies responses in a shifting landscape, data and research. So Norway is a small country in the north of Europe, comparable to Victoria, which I was fortunate enough to be invited to join in 2018 during their launch of their early years strategy. It is comparable to Victoria. We have around 5.4 million inhabitants, and our Sami population constitute around 1.8% of the population. In 12 of our 356 municipalities, Sami is the official language besides Norwegian. To set the scene, I will also have to give you some of our latest corona figures. So far, 12,500 have been infected since the outbreak, and 266 have died. 20 are currently in hospital, 2 of them in intensive care. Testing is high in Norway, and over 930,000 have been tested so far. And as you can see in the graph included in my slide here, there's a lot of testing going on just now. So kindergartens in Norway are based on a holistic pedagogical philosophy, with care, play, learning, and danning, formative development being at the core of the activities. Hopefully the short film on the kindergartens in Norway that we're introducing my presentation gave you a glimpse of the pre-COVID situation in our kindergartens. The Norwegian kindergartens values childhood and has a pedagogical philosophy which combines education and care. We see education and care as linked and integrated. Pedagogies for the youngest children are play-based and child-centered. Well-being and joy should be ensured for every child, and kindergarten shall foster and support children's creative sense of wonder and need to investigate. Friendship and community, social skills, and communication and language are very important topics in our framework. Democracy and children's active participation is promoted and clearly stated in our legislation and framework. And together with sustainable development and life skills and health, it is now one of 3 transversal themes that runs across both the curriculum framework for kindergartens and the curriculum in schools. Children in Norway have a statutory right to a kindergarten place from 1 year of age, and school starting age is 6. Uptake is very high. 92% of our children between 1 and 5 years old attend kindergarten, and of these, 20% of them have a minority background. What is more uncommon globally is that 96% of our children have full-time places, which is that they have available places for over 41 hours per week. Having integrated institutions means that the type of horizontal transitions that children in some countries might face going from the part-time preschool to out-of-school care is not happening. 50% of our children attend privately run kindergartens, but all are publicly funded. And the home-based provision is not so common anymore. 99% of our kindergarten places are center-based. Public funding is high. 85% of the running costs are covered, and this goes across ownership for both private and public kindergartens. All of them are entitled to equal public funding. Parental fees only cover 15% of running costs. And since 2004, we have had national regulation on fees. And these maximum fees are set down in the national budget every year. There's a discount for siblings, and we also have free core time for children in low-income families. Quality is and has been important in the policies for kindergartens in Norway. in Norway, the staff is composed of head teachers and pedagogues, both educated from university colleges with a bachelor degree or more. And the kindergarten teachers and assistants, they work together in teams with groups of children. Many of the assistants have vocational training as youth and childcare workers from a college. The proportion of men working directly with children between the ages of 1 to 5 is 9%. Not high, one could argue, but higher than in most countries at this age level. The regulated number of children per teacher has been reduced so that there now shall be a maximum of 7 children under 3 years of age per teacher and a maximum of 14 children over 3 years of age per teacher. At the same time, we have regulated the staff-child ratio, and these must be seen together, so that the staff-child ratio is 1 staff per 3 children under 3 years of age and 1 staff per 6 children over 3 years of age. These figures were important when we were trying to develop the measures during the COVID-19 crisis. So this is about the close down. Corona hit Norway the last week of February with increasing numbers of infected day by day, and developments were followed closely by the authorities, and big efforts were done to track down and isolate people that were infected. The health authorities and the government were in collaboration deciding how to deal with the crisis. On the 12th of March, after local actions had been taken in some municipalities to close down schools, etc., the day after Denmark put out their decision to do so, Norway also decided that there should be a national close down of schools, kindergartens, higher education, personal services like hairdressers, etc., gyms and the like. People were asked to work from home, and from the 13th of March onwards, the ones that could had home office, home kindergarten, home schooling. This presentation is about early childhood education and care, but obviously to schools, the demand to do online schooling and the digitalization of the instruction was a factor that just had to be mastered by everyone. Also for kindergarten leaderships and staff, as the close down persisted, they needed to think about how to communicate not only with parents, but also whether they could connect with the children. Schools were closed, but there were some, and kindergartens were closed, but there were some exemptions. So staff who perform critical public functions and children with special educational needs and vulnerable children should be provided for even during the close down. Close down has, of course, also economic implications, both direct and indirect. And in terms of the close down of the kindergartens and schools, 2 issues arose. With the composition of our sector, which is 50% of the children attending privately run kindergartens, it was crucial that the government decided to make sure that public funding was upheld at the same level, even though the provision was closed. This was important to make sure of the availability of provision for the exemptions, but also to hinder big layoffs. The issues of parental fees also needed to be solved, and the government decided early on to waiver the parental fees during the close down. For the kindergarten owners, the private, but also the municipalities, knowing that they will be recompensated for the lack of parental fees, this calmed the sector and was in many ways crucial also for dealing with any other businesses and challenges that arose. The stakeholder discussions, for instance, on vulnerable children were easier to have when issues of funding was solved. Also for parents, making sure that they knew that they could stay home if their child was sick, that they could stay home without economic implications. So we have already an organization with days of care leave for parents with children under 12 years of age. And the number of days has been doubled during this year, and even if there's a need due to local close downs, the minister has said that it will also find solution for this situation. Reopening also incurred extra costs. So reporting now from the municipalities and private kindergarten owners is about need for extra staff and stand-ins, and also the costs of extra hygiene and material. And we are looking how to solve this issue. You have all lived through this crisis, and both personally and professionally, the daily press conferences that has been essential to understand and deal with the crisis, both in the personal life, but also in the professional situation. Coming from the Ministry of Education and Research, responsible for education for children from birth onwards, I must say that the press conference that was held specifically for children, answering to the questions on friends and school and play and holiday and the national celebration of the 17th of May and the celebration of their birthdays in their own lives, it was touching and also indeed signaling to us all to take children and their questions and worries seriously and to listen and act on them. The Prime Minister, our Minister of Integration and Education, and the Minister of Children and Family Affairs, they held joint conferences answering the children in addition to the daily ones to the general public. Stakeholder consultations were crucial, as all solutions on funding and running and regulations, these new solutions had to be found. And our minister, who arrived just before, a week before, she arrived to the ministry just a week before the decision to close down, she has been and is in contact with the stakeholders to deal with any business that come up, such as the kindergarten owners, the staff organizations, the parents committees, and the organization of for children with special needs and the NGOs and so forth. An expert committee with participants from the directorates for children and youth and health and care were also constituted. They joined together with the Institute of Public Health to provide advice to the government on the situation of the close down and the possible reopening. And their report concluded that with the concern for the vulnerable children and with the knowledge that was about the children's role in spreading and transmitting the COVID-19 virus, it would be, if due care was taken to prevent transmission of infection, it would be best to reopen the kindergartens. The regulations on close down obliged the municipalities to establish provision for vulnerable children, but we had reports that this didn't happen. There were examples of healthcare personnel that was redirected from childcare services to other, to the hospitals and so forth. And also the home visiting from child protection services was reduced. It was too long time to ensure help, and the ministers and the NGOs and the experts all raised strong concern, and they called for action through their press conferences and so forth. It led also to establishment of a coordination group for services to vulnerable children and youth. It was led by the Directorate for Children and Youth. This group is still in function. It presents reports on the situation every 14 days to the Minister for Children and Youth, and now the 7th report has already come out. It is also presented to the public. Just to give you an example, researchers have also been active during the close down, and a project at the Oslo Metropolitan University put out a parental survey during the close down in one of our challenged areas, and it found that the reduced economic activity and layoffs, it hit the most vulnerable the hardest, the ones living in cramped conditions. It also affected the children. Children living under such circumstances was less likely to be taken outdoors to play, and more parents in this group found it harder to engage positively with the children. Kindergartens play a crucial role in the care and development for children, and this has become so evident during this crisis and the close down. The situation can take a long time, and it is of utmost importance that children can continue to go to kindergarten during the outbreak at the same time as preventing and the spreading of the disease, both to children and to staff. The UN Convention on the Rights of the Child demands of us to act in the best interest of the child, and the pandemic challenges us in considering how we best can do this. In the discussions, it has been, of course, with different positions on what is protective and what is safe to do. But we ended out with saying that it is best if they come back to kindergarten. But we also needed to discuss how the provision needed to take care of limiting the possibility for transmission of the disease, and of what was important. So discussions on how we still could make sure that children had the care, the comfort, the community, and the closeness in a situation of social distance. We also need to look on how we could allow for the play and the movement that also promotes the development and well-being of the child, and how to ensure the inclusion and support of every child. So the illustration that you can see here on the slide is a short film to the children from the Directorate about the COVID-19 virus and how they can protect themselves and still be safe while they're in kindergarten, playing with their friends and being with the adults there. Take care to wash their hands, stay home if they're sick, and be with their smaller cohort. Based on the report from the expert group, the government decided to take cautious and controlled steps towards reopening. Kindergartens would open from 20th of April, 1st to 4th grade in schools from 27th of April, and as of 11th of May, all schools reopened. Guidelines for the reopening had also to be developed, and the kindergarten for these were ready just 5 days before the opening on Monday 20th. Some principles and some concrete advice were formulated. So I just mentioned them. 6 persons should not attend, neither children nor staff. Good hygiene needs to be in place, both materially and personally. And the organization should ensure reduced context and safe distance. The concrete advice was that reception was done outdoors and should be organized so that it would be over some time, so that not everybody came at the same instance. It was specifically to reduce the possibility for parents actually to have contact, because we know that the contact between the grown-ups are also more infectious. More importantly also, the children should be organized in so-called cohorts of 1 staff to 3 children under 3 years of age and 1 staff to 6 children over 3 years of age. And these cohorts should be stable. Children should not play with children outside their groups. The staff should collaborate across 1 cohort but very cautiously. The staff could collaborate, but only to make it practical. They should not sort of move between cohorts. As things progressed, we are on what we call a yellow level, which means that the yellow level is that the whole department, the whole bigger group of children can be together. It's now another cohort, a bigger cohort, and the staff that work with the Department of Children, they can also be together. So the group size has grown after the first couple of weeks after the reopening. The hygiene advice was required toys to be cleaned during opening hours, and of course strict routines for hand wash and so forth. The advice was to stay as much as possible outdoors, and we were lucky in one way because it was springtime when we reopened, and so being outdoors was feasible. For the kindergarten leaders and staff, it meant they had to organize in new ways, where they previously could collaborate across the opening hours and have smaller and bigger groups throughout the day. Now the small group structure meant that they were less flexible and more vulnerable to sick leave, etc. The opening hours was and is to some degree still reduced to be in line with the working hours of the staff. And extra personnel and extra work for staff during the day could be put on to have the toys and the premises cleaned. Attention and routines had to be put in place in order to act on signs of cold, fever, runny noses, and coughing among children and staff. This has now, we have some experiences now. So now the People's Health Institute has put out what do you call it? A scheme showing when you have to react. So runny noses are allowed if the condition of the child is okay, but these are the type of concrete advice that is necessary for the staff and for the parents in order to see whether the child can come to the kindergarten or not, and when is the time to react. We still need to communicate and discuss this issue of how to deal with colds when children have a cold or show signs of cold. For the staff, there should be a heightened sensitivity, and we have of course seen after reopening, after the summer's break, we have seen that there is a sensitivity out there, so that the need for extra staff and for stand-ins is there. Dealing with parents' concern have also been an issue. And there was an issue that if we open too early, that would be sort of in a way experimenting with the child and the health and safety of the child. But we haven't seen outbreaks as such in the kindergartens and schools. So although we could understand the concern, luckily what we saw was that when the due attention was given to prevention of transmission, then it was possible to have safe reopening. When we reopened, there was this sort of worry and lack of trust, meant that it took some time after the reopening before all the children were back in kindergartens. And it was especially evident in the less affluent areas. So for instance, in Oslo, which is our biggest city, we saw that for the first week, only 1 of 4 children in the less affluent areas were participating. And it did increase to 51% in the 3rd week, but our latest data from the sector showed that now we are back to around 90 across all the different socioeconomic groups in kindergartens. But we still need to communicate strongly that it is safe for children to come to the kindergarten if due attention is given to hindering the transmission of the disease, and that kindergartens and schools are doing all they can to do so. There is variations across municipalities and ownership, but as the graph on the right-hand side showed, but still we can see that the number of children that were not attending has gone down. So the same tendency has been there. The consequences for families where data on the consequences for families were collected by the National Parents Committee survey. And it showed that the kindergartens, 94% of the parents had been in contact with the kindergarten during the close down, and for 50% of them more than once per week. Primarily it was done by phone or mail or social platforms, but also we could see some examples of circle time online and even home visits. In this contact between the parents and the kindergartens, the topics was connected with the well-being of the child, and also advice for activities and how the family is doing was what they were discussing. We could also see that there were different positions in the need for having this type of advice, and for 25% of the parents, they also needed information on where to search for help. Now we are in a situation of continuance. The traffic light model that we have developed, it has 3 levels that you should sort of have actions on, dependent on the infection situation in the local, in the municipality. We are also observing it on a national level, but as of now, after the reopening, after the summer, it has been linked to these 3 levels. So green would be going back to normal, but with the general advice to prevent infections. We have set the national level at this time to be on a yellow level. So it means that there's measures to reduce contact between the staff, and the departments will be cohorts, and there's a divided outdoor space. On the red level, it was the situation just after we reopened and when we were on a close down. So it will be full or partial close down and strict measures to reduce contact. So we will be going back to the smaller cohorts and with just 1 stable staff per group, and a strict routine for parents when they deliver. The kindergarten owners shall make plans to be prepared for different levels of infection control, and our latest survey shows that they have done so. So nearly all have already put in place this type of plans. The final comments that I would like to make will be on the policy responses and the need for data and research. We are facing a shifting landscape for policies, and without the open channels with the sector, the exchange of information and the collaboration around workable solutions, we could not deal with it in a good way. Decisions are to be taken by governments based on this exchange with experts and practitioners. And in our case, the municipalities, the owners, the parents, the NGOs, the teachers and staff unions. And this dialogue is again used to communicate solutions to the sector. Having learned from the close down the importance of kindergartens to children's well-being, care and development, we are faced with the challenge to communicate both to the sector and to the parents that we do everything we can to keep the kindergartens and schools open in a way that will be safe. In a shifting landscape for practitioners, they and the kindergarten owners need to stay attentive both to the advice that can be shifting and the situation on the ground. They need to deal with and live with different phases of uncertainty and to handle risks in a sensitive way. And their daily routines, the way they organize their works and contacts and pedagogies, need to answer to the COVID-19 situation. Actually, coming from the sector, the small group organization was deemed positive, as well as the broad outdoor activities that were developed during the first phase of the reopening. So hopefully some good has come out of this as well. In terms of the shifting landscape for knowledge, we know for sure that it has been so hard to make these hard decisions on both closing down and on opening up specifically when knowledge has been so scarce. But luckily, the health researchers are also in global networks, and they are sharing what we know, and they are developing new knowledge as we go along. So what I would say is that we need them. We need them to participate in the discussion on what we know and what we do not know. And we need also to communicate this uncertainty in a reasonable way so that this complexity can be dealt with. To the practitioners, it's actually in this situation where they need to deal with so many other things, I think that if they can also see it possible to deliver information about the situation on the ground when they are asked by researchers and when data is collected, I think that this will help us in developing policies going forward. So with this, I will thank you for your attention, and I have prepared a final slide with some general information and COVID-19 related information that perhaps can also be helpful in sharing information across the globe. Thank you.
Hi everybody, and welcome to the Q&A and the panel session that we're going to do now. We're operating in this environment where we've got Tove and Jane on our screens in front of us, and I have here with me Cathrine and Tony. My name's Leanne, and we're going to try and do this roundabout. We've lost the vision of Tove, so hopefully she'll come back on in a moment. There she is. She's just popped up, which is fantastic. And we're going to be asking some questions, and you've asked some amazing questions on the Q&A. We will try and get to all of those, but chances are we won't. But what we're going to do is promise to respond to these and also put these to Tove and Jane so that they can also respond at a sort of in a written form, I suppose, because we don't want to put too much extra work on you, so that there are responses to all of these questions, because people have listened to you both with such keenness and have been asking such astute questions. Just to make a note that it's about 5 or 6 o'clock in the morning for Jane, so she's supercharged on coffee, and Tove has an easier time of it because it's the middle of the day. So welcome to you both, and thank you so much for your presentations. They were absolutely amazing, and we will get started with some questions. So just to be sure that you can hear me and that we can hear you, if you can say unmute and say hi, that would be wonderful.
Hi.
Great.
Hi.
Hi, Tove, thank you. All right, so one of the questions that has come through, we've had a number of questions about this on vulnerability. And so the questions to you both are around the equity issue and the vulnerability. And what about, for a start, families who perhaps live on the fringe, young people who live on the fringe? And what are both of your countries doing about those families and those children specifically during this crisis? So let's start with Jane.
Well, it's very difficult to give one answer because there's 13 jurisdictions. We don't have any pan-Canadian oversight for education or early childhood care and education. So we have really 13 different responses to supporting families. And it's pretty chaotic. We are experiencing a rapid second wave or build up towards a second wave. We're coming out of summer, going into fall, and the summer was looking like we were getting lower and lower COVID. School was to start up in September. And but in our biggest provinces, the COVID rates are going up very rapidly, more rapidly than expected. So it's chaotic. And yet we have other parts of Canada where it's very limited COVID, and therefore things are different. Generally speaking, the current context has amplified flaws in our safety, in our social networks to support vulnerable families and those who are on the fringes. And it's been left up to local, municipal, philanthropic responses to rapidly try to find housing for those who do not have housing and young kids. We're finding as schools reopen, schools in the more affluent area are more likely to have kids returning versus schools in the higher needs area where the COVID rates are higher. Kids are far less likely to be returning to school. So we see those inequities growing. We are awaiting in a few hours from now a throne from the speech from our Prime Minister, which should give some direction on where we're headed. What the government's response is. There was an immediate emergency response to a basic income without needing to provide a whole lot of background, a whole lot of qualifications to access. It's called CERB, Canadian Emergency Response Benefit, $500 a week. And just about anybody who applied for it could get it. And that has helped. That has helped precarious workers, but we don't know where that's going. So I'll stop there. Our childcare centers have reopened pretty much. It varies from jurisdiction to jurisdiction. In Ontario, the largest province where I'm situated, they're at about 50% enrollment. Families are reluctant in many cases to return to those settings. Schools are in the process of reopening and far more opted for online than actually attending in person than was anticipated.
So it's a bit of a work in progress, Jane, and maybe you'll know a little bit more later. So we'll probably try and get an update from you when you've heard from your Prime Minister. Tove, what about in Norway?
So I think that one of the clearest messages that actually came out during the close down was this concern for the vulnerable children and youth. And I think that this has put this to the forefront in our policies as well. We are in a welfare society, which means that we sort of tend to have the universal policies that we really try to develop in order to reach all groups, even the vulnerable children. I think that what happened when during the close down and the reopening was the establishment of that coordination committee that is delivering reports to the minister and to the general public every 14th day. It means that all services, different services, whether it's about child protection services or whether it's the schools and the kindergartens or health institutions or what do you call it, where the children live or the vulnerable families, all of these topics are being raised in that by this coordination group, and it's being collective reports on the situation on the ground. And what they've done during these reports, it's now 7 reports, is that they put out the general advice as to where you need to move in order to amend the situation so that you don't have children or youth that is falling out of the general availability of the system. So for instance, in terms of first, we developed the guidelines to make a safe reopening of the kindergartens and then the schools. There's also now developed guidelines for the child protection services. How can they protect themselves so that the infection will be reduced. And I think that this collaboration across the directorates that is concerned with children and youth, including the health authorities and the Public Health Institute, is absolutely vital in dealing with the COVID-19 crisis. In addition to this, of course, what you also need to do is you need to have the type of more direct measures and funding packages. So there's a number of measures that have been taken, funding for to have measures towards students that need to catch up, or to have extra sort of measures in order to reach out to the children with special needs. We had, during the close down in summer, we also had extra funding for the summer schools or the summer holiday, what we call it, centers or what, yeah. And also there's extra for what we know about the vulnerable children in the families, because of course the concern is that when we are getting reporting back now from the youth is that some of them actually found that the close down, it brought them closer to their family. It gave them more time to relax. It gave them more time to sleep, if you want. It's sort of there's a kind of a divide again, because some are closed in a situation where they are not being taken care of, whereas others are being allowed time and less stress. So what we are concerned about is especially the ones that are being closed down in situations where they are not being protected. And so a number of the measures that we have put down has been directed towards answering to these special needs. In terms of the communication with the families, getting the message out there that it is safe to come back when we are doing it the way we are doing it, I think that is absolutely important. And not having that kind of discussion that it is unsafe. So whenever it is, we try to be honest about how we deal with things, and then to take on the questions and to answer to them. So there's conferences with parents answering to their questions and so forth as well. Yeah, I don't know whether this answered your question, but anyway, there's targeted measures to deal with the situation.
Thank you to you both. And that, I think in part that has answered that question. And I think it's also, Tove, as you're saying, it's not that simple. It's just, and Jane, you're saying the same thing. It's very, very complex, but that's an interesting insight. You did talk about funding, Tove, and this is something we ran a poll to ask what one of the greatest challenges was during this time of COVID for early childhood settings. And they did say funding. We've had some challenges around funding. But also you talked about funding for extra assistance for children. We've had an interesting question. I'm going to put it here to Cathrine as well in a moment, but people are asking about children staying in their early childhood settings for another year before entering school. What's your thinking around that? I'll start first with you, Tove, this time.
Well, that question, it doesn't really fit with the way we think about school starting age, because we are not preparing. Well, we have a dual sort of task of our early childhood setting. It's the here and now perspective, and then of course it's preparing for life. And we need the schools to be ready for children, whatever circumstance they are in. So we don't really have that kind of readiness for school testing, which gives them an extra year to enter. But the issue was still raised during the close down, because when we were discussing what groups did we need to reopen for first? Should it be a gradual reopening, or should we open the kindergarten as a totality? Then of course these type of considerations were put into the discussion. Should it be that we tended specifically for the ones that were in the last year of kindergarten and would be starting school in the fall? Or should we tend to the children without language, which we really needed to make sure that we're cared for? So the youngest children, the 1 to 2 year olds. And this type of discussion was sort of put onto the table, but we ended up by saying that we open for all. But there was a consideration, of course, to make sure that these children, which were in the last year in kindergarten, that they had a good transition and a last month before they went into summer holiday and then now enter school. And there's been attention also given to the reopening of the schools and to have them the way that they are received. Yeah, thank you.
Great. And Jane? This extra year, the idea of an extra year in early childhood education.
That hasn't come up as an issue here, and as a similar perspective on it as Tove talked about. Schools need to be ready for children, not children ready for schools, wherever they're at. And rather than a lot of emphasis on readiness skills, which typically mean more the academic things, there's much more concern about social emotional well-being and what we can do to support that. Other learning will follow if kids feel comfortable and are feeling safe, and their well-being is taken care of, the resilience. So the focus is much more on that, and much not thinking about holding kids back. Also, what was really become apparent across the country is that kids who are in programs and ECE programs like those programs, and they're missing their friends, their peer groups. So the notion of pulling them back outside of their peer groups, what they want to do is get back with their friends. And so we're not trying to, I haven't heard any discussion of trying to get in the way of that. There are three trends or approaches that I see educators, particularly early childhood educators, as well as in our ECE programs, as well as teachers in our kindergarten, which is 4 and 5-year-olds, and into primary, are much more emphasis, one, on outdoor play. We're nowhere near Norway on embracing winter and outdoor play, although we have a climate that's not that different in much of the country. But we're seeing much more of an emphasis, and much more across the country, on how can we promote outdoor play and keep it going into the winter. We're seeing some real attention on social emotional well-being as needing to be the priority that we build on to support other learning. That's cutting across ECE and into the primary school. And finally, we're seeing this emergence of things, early childhood educators are a creative lot. And we're seeing emphasis on things like games with masks on. How you can, with a mask on, show an angry face and a happy face and read that from just the eye expression, and those sorts of things. And otherwise, trying to normalize mask wearing, because it looks like in our country it's here for a while. So those are some of the ways that we're addressing where kids are at, and trying to pay attention to vulnerable kids who are experiencing more difficulties and bringing them along, rather than thinking about holding them back for a year.
Yeah, and I think your point, you won't get a single educator within this webinar, I'd say, who would disagree with you about the schools being ready for children rather than children being ready for school. That's not necessarily the narrative that we have in Australia, and we have different timing around when children start school as well. Yeah. So we're going to have a different timing around this crisis. So maybe Cathrine, you can respond to that.
I echo what both of you said. I think that question comes from a very clear narrative about school, children being ready for school rather than schools being ready for children. And I think that's potentially damaging, because it puts the expectation back on children. And I think there's an overemphasis of what's happened in the last 12 months, where the reality is children have been getting ready since they were born. All the experiences they've had, all the relationships they've had. And so I think we really need to think about that shift. And if we're thinking about making sure that the school environment is ready for children, I think we need to be driven, our decisions need to be driven by a number of questions. And I think first of all is, what do children need in order to achieve? And how do children learn best? And we know that they learn best within the context of high quality relationships. So a prioritisation of relational pedagogy and play-based pedagogies. So if we are going to ensure that children feel safe and secure, and that they're ready to learn, and that they can engage socially with their friends, then the first year of school has to look different in 2021. And so this could be a gift of COVID. It could be an opportunity to really reflect on what early childhood pedagogy looks like in the first years of school, and that we can shift that. And we need to prioritise and continue to prioritise the relationships with families, because families have been the constant for children throughout this process. And a lot of the impact that early childhood educators have continued to have on children are through families and parents. So I think we really need to shift our lens and shift our narrative and focus on children and focus on prioritising what their needs are within that different context.
Great, thank you. I think I'll just move a little bit into that families area, because that's one place, and I want to bring Tony into this conversation, because we're thinking about, and quite a few people on this webinar are from other countries where there is a great deal of poverty and disadvantage as well, and they're asking some questions around, look, there's differences here. You've been doing some work around what children's movement behaviours are right across the world. Can you tell us a little bit about that during COVID?
Sure. So we actually conducted a survey where we went back to 14 countries that were involved in a study called Sunrise, where we collected data prior to COVID. Then we went back to those countries and collected data on the children's physical activity, screen time and sleep during COVID. And we asked a whole range of questions around what factors might be contributing to those changes. And I wanted to pick up on something that Jane said, and that's the importance of outdoor play. And what we found is in countries where that was not possible for a range of reasons, restrictions, home confinement, even early childhood education and care services being closed, the impact that that had on children was significant. Obviously, it affects their physical activity levels, but we found that those children were spending far more time on their own, engaged with electronic media devices, often while they're being sedentary. It affected their sleep, and importantly, it impacted on the parents' stress and exhaustion levels as well. And so we're actually recommending that we have to get that balance. Obviously, when we're controlling infections, that's important, but also we need to think about parents' mental health, children's mental health, and trying to accommodate ways in which we can promote outdoor play in environments where that's going to be challenging.
And you also were talking with me earlier about the impact that early childhood education settings had on that. Can you explain?
Sure. So what we also asked parents was what level of support they had from their early education and care service. And we found that compared with parents who didn't receive a large amount of support, those that did, that their children were actually able to have better sleep patterns, were able to better regulate their physical activity, and they had a better structure about their day. So they found that that actually also helped the parents with getting done the things that they needed to during this time.
So this was the interaction between the home and the educators, and that they were actually helping to regulate some of what was going on in the family as well.
That's right, trying to bring as much as possible that sort of sense of pattern and normality.
So I want to focus on that, because that's a huge responsibility. That's, an educator actually regulating what's happening in a home during a crisis. So that brings us to this essential worker, the educator. And this has been a really challenging area in Australia around educator wellbeing. What about in both of your countries, Stan and Tove, in terms of, first of all, how educators have been seen, and then also what have been any particular concessions around their working situations and how they are being attended to during this crisis? I better say I'll go first to Tove.
Okay.
I know you were both deciding who was going to answer that.
So of course there's been discussions, and the collaboration between the minister and their staff organizations has been very, very important in sort of lifting the situation of the staff as well. And when we were reopening, there was concern towards they were sort of concerned to be taken care of in terms of the transmission of the COVID-19 virus, and whether this would sort of put them at risk. And so the collaboration again with the Public Health Institute that put down the guidelines and how you act in order to reduce the possibility for transmission, that was crucial, I think, in order to make them feel safe that they could come to their work. But at the same time, there's an issue of how do you deal with the number of days of sick leave, and how do you do you have stand-ins, and what are your expectations on that side? And I think that when the advice is that you have to stay home if you feel sick, and the clear advice, especially for staff, you should not go if you feel sick. And then now with putting in place a testing regime that makes you it makes it available so that you will know whether you have the COVID-19 or not. I think that is a combination of how this structure that we have around is helping the staff feel safe. It's helping reducing the transmission in the settings, and it has to be combined with the situation economically, so that in Norway we have a system of sick leave, so you are covered if you are sick. So you don't lose your wages. You're not hired by hours. You are hired. You're hired. You have your work during the whole year. It's not by hours or by weeks. It's full-time sort of employment, if you want, for the most part. So only small part of the groups have been, or exemptions have been sort of hit by this kind of layoff. It's in a system where we take care of our staff. In terms of the view and the recognition of the importance of the educator, I think that has really been put up there now, because we know of the importance of kindergartens being available to children and to youth and to the pupils. Then of course they are more highly valued now. We know that the parents who are trying to do the home kindergarten and the homeschooling, they know the value of their teachers, and they know the value of their staff that can support their child and that can also help it. So it's yeah, I think these are the two outputs. We know we are having a system to take care of the staff, and we are also now recognizing the importance of the staff, and that is general public.
Great, thanks Tove. And Jane, the educator perspective.
Again, it's chaotic in Canada because there is no one answer to your question, because we have different systems. But I think I could make a generalized statement that where early childhood education is offered within public infrastructure, there has been there's been more support and a smoother, more support for the educators, for the early childhood teachers. There has been and a smoother reopening. So for example, here in the city of Toronto, we have a number of municipally operated programs. All of the staff are qualified, etc. And they provided the emergency care for essential workers at a few centers. So they had some experience. They provided guidelines, and they supported others as they reopened. So that has been quite smooth, quite successful. Those educators are well compensated. They have sick leave, etc. Where we get into more of the programs that are delivered through the market, either small nonprofits or commercial centers, it's much more chaotic. They're many staff aren't returning. There's not that support. So, you know, we're there. And the public school system is a whole other issue. There's lots of debates and friction with the teachers and the government and the educators as they reopen. Sick leave is one of the topics we expect to be given a nod or somehow addressed, where we're going with that in today's throne speech from the Prime Minister, because right now there is no required sick leave, and it's creating the problems of, you know, how do you're supposed to stay home when you're sick and you don't have sick leave, or you have already used up the meager amount you have. What do you do?
Mm. Yes, and very similar challenges here in Australia as well. Now, I know we're heading to the end of this time that we had questions. We have so many more, but what we will do is we'll follow up on these questions with all of our panellists. I just want to ask one last question of you both. I know that there's few of our panellists who they're racing off to different places in Ireland and across the world, which is the nature of Zoom these days. But what I want to ask is, how do we keep this firm focus on children? And what I'm going to do is I'm just going to flip quickly to Cathrine here and ask you, how do we keep the firm focus on children?
Yeah, I think COVID has given us a platform to really continue to focus on that. And I'd just like to revisit the narrative around children from vulnerable families. And I think this has really highlighted the potential for opening inequalities. And I think we need to develop a much better understanding on how to support children and families from vulnerable backgrounds. But more importantly, how do we do this without stigmatization?
Yes.
And I think that's really important in terms of if we're going to see early childhood as a step up for all, and I borrow those words from you, Jane, because I think that's important, we need to have a much deeper understanding of the policies and procedures that we need to adopt in order to achieve that.
So you're saying not to stigmatise, so that we're segmenting all of this market.
That's
and
right.
saying these children need this.
Because we've seen in Norway, we've seen in Canada, we've seen in Australia, that the minute that we target a particular group, they don't access that. And so we really need to look at a universal system, but particularly that supports the children that we know need it most.
Okay. Tony, how do you think we should keep a firm focus?
I think we
children?
need to keep the focus on children's right to play. I think that what we've been able to see through this pandemic is that when that right is taken away, it has a whole range of adverse consequences, both to the child and to the parent, the carer, and even to the educator. And I think that we need to protect that, and we need to have particularly protect it in low and middle income countries where they don't have the necessary infrastructure, the resources, the environments to be able to promote that norm. Yeah.
So the right to play. Thanks, Tony. Jane, can I go to you? How do we keep this focus on children?
Well, I build on both of what Tony and Cathrine have had to say. I agree with both of that on how we need to go forward. It is a concern in Canada because much of the attention that's been given to early childhood care and education is the recognition that it's absolutely essential to reopen the economy. And it's absolutely essential to get women back to work, no doubt about it. And we need to use those levers, but we don't want to do it at the expense of forgetting about kids are at the center. We want to lead with the child, not lead with, we need it for the economy. And that takes us to, we need it to be universal. We need it to be for all kids. We need it to be for children. They're entitled to it because they're a child of a certain age. They're not entitled to it because they have a working parent, because many children in vulnerable families won't have a working parent. So we don't want to make that your ticket in the door. We want that universal provision is more important than ever. And thinking about it from the perspective of the child. You get it because you're a child. And then all kids come for it. It's not stigmatizing. And we take it from there. I'll stop there.
Thank you. And Tove, what do you think? How do we keep this focus on children?
Well, to again add on what the others were saying, I do think that there's a focus that sort of came out during the reopening, which is that the child belongs to the community. They are part of a smaller community of children, and they need to sort of feel the sense that they are included there. And this is what is important in terms of having it universal, is that we need to have attention on the children who are not coming back because we want them to be there. And this recognition of the importance of the early childhood education and care in providing this space for community and for play, and for being outdoor and for connecting with others, to have that sense of belonging. I do think that that is very, very important. At the same time, I do think that they're recognizing the importance of early childhood and the quality that we provide for the children in terms of providing for them both here and now, but also for the future. I think that this dual image, if you want, of where we want to go, that we need to deal with it in a wise way and to discuss how this COVID-19 crisis perhaps have given us some new keys to understand and to develop new policies for better quality in our early childhood setting. So, and the coherence throughout the educational development or the educational path that they are going to take. So I think that is important. Yeah, thank you.
Thank you. Thank you so much. And we're going to just draw this to a close. Thank you to Tove and Jane for your inspiring presentations and for responding so easily to these questions, and to Cathrine and to Tony here. It's been wonderful. And we just wish that you were here. Yes, both of you were here with us, but it's been fantastic to connect up. And our educators and various policymakers on this Zoom have been putting wonderful messages there for you to thank you for your presentations and say how inspired they are. I say that what we do is put educators in charge of the world and probably everything will be okay. But for everybody who has been on here tonight, we will send you lots of information. The slides will come to you, and also we'll get some more responses to these questions. So thank you very much to everyone who's participated in this Early Start webinar, and we're looking forward to doing more of these in the future. And for now, Jane will let you go and get some more coffee, and Tove will let you go to Ireland. So thank you very much. Thanks, everybody.
Bye. Thanks.
Bye-bye. Thank you.
Thanks, Jane. Thanks, Tove.
Thank you.